These are the books that are currently available. The first one that I'm going to talk you through is Transitioning into the Test Room. What it basically goes through is how to prep in advance of your pre-reg. So what do you include in your logbook? How do you prep for your eye test? How do you prep for your contact lens assessments? What sort of things do you need to put in when you're doing your record keeping, but also what sort of questions you should ask. One of the important things that's included in this book is how to avoid retest, because when we're doing eye tests, we need to be aware of how to avoid the retest, and it goes through in detail what sort of things you need to be discussing. The next one that we've got over here is history taking. So within history taking, I've got a couple of different variations in history questioning that you could cover. So obviously the overview is included, which includes the reason for visit, general health and medications, what sort of questions are you asking within ocular health, family history, lifestyle, but also if the patient specifically has headaches, red eyes, blurred vision, double vision, flashing lights and floaters, it goes through a list of questions that you should be asking for that particular problem. Within the practical examination, we cover quite a few of the practical skills. A lot of these do come up in, for example, the OSCEs. And basically we've got your routine eye test and what you should include within your routine eye test. But then it's also breaking down how you would do your refraction as well. It's got what sort of things in step-by-step instructions you should be doing for things like Amsler, color vision, stereopsis, Goldman. And there are some step-by-step instructions to tell you exactly what to do and what to say for each one of these tests. The most popular one at the moment, rivaling the OSCEs and the contact lens book, is the visual fields book. It's got quite a few diagrams in it explaining what sort of things you should be looking out for. So it does break down a visual fields plot and actually explains what each graph actually means and what the normals would be for each one. But then it also has diagrams to explain to you where the visual field defects would occur. So if there are any horizontally respected visual field defects versus vertically respected visual field defects, it does actually break it down in terms of also where along the visual pathway this problem would be. The contact lens book is the newest one that we've got at the moment, and that one actually goes into quite a lot of detail with regards to what's actually happening with contact lenses. It covers soft lenses as well as RGP lenses, and there are quite a few diagrams on here to explain things like toric lenses, multifocal lenses in terms of their design and their stability, as well as, for example, slit lamp techniques as well. So how do you actually look at the external eye and what are the complications that could be visible? Something that's useful in the back of the book over here is also the grading scales that you can then use in your practice. So they're made into an A5 size so that you can look at them in detail and you can use them as a reference. You've also got two of the case scenarios from the stage 2 cases, which are broken down in terms of what is actually expected. So this is actually one of the case scenarios, and it tells you what sort of things you should do, how should you change your lens, and what's the actual fitting that you should give instead. This is the dispensing book. Again, one of the other favorites because it's actually got a whole bunch of questions that we can look at the end. So there's a whole bunch of practice questions. And the useful thing is that there's a whole bunch of answers with a QR code that you can scan, and you can listen to me talk through what the answer would be and how it's worked out. There's also explanations on prisms, BVD changes, minimum size uncut, with diagrams to go through all of it as well. One of the commonly requested books around the OSCE time is Discussing Pathological and Physiological Conditions. This basically breaks down the structure that you need to use within communication. It also breaks down how to discuss things when there's breaking bad news. The common conditions that I discuss within this book is glaucoma, AMD, retinal detachment versus a posterior vitreous detachment, papilledema, vascular occlusions, retinitis pigmentosa, cataracts, and also the physiological conditions, so myopia, hyperopia, astigmatism, presbyopia, and amblyopia. There are case scenarios that you can then look at to say, okay, well, this is what the situation is, and then I would explain it to either the patient, or we might have a different situation where we're explaining it to an examiner. So we're looking at the techniques in terms of how to explain something to either a patient, an examiner, a different healthcare professional, based on what the problem might be. And the OSCE Station book is one that got sold out really quite quickly, especially when it was first released, because it basically goes through 15 different stations in terms of breaking the station down and actually explaining to you what sort of problem there is within the actual case scenario. So you see a candidate instruction and you have 5 minutes to actually try and attempt the station, which you should do. And then you can see what the breakdown would be. So what are the things that I want to be looking at? What are the words that I want to say? What are the key pieces of information within the case scenario that you need to be able to explain? And then you've also got the attempt in terms of what sort of things is it that you should say and how should you say it. So it's all broken down into detail. Towards the end of the book, it gives you a couple of key points or advice in terms of how to deal with the different types of OSCEs. So you've got clinical examination and practical skills, communication, data interpretation, and history taking. So we've got a little bit of advice on how to deal with those sorts of stations.